Okay. All right, I think we're live on Facebook. Welcome, everyone. Thank you for joining us this evening for this important conversation about reimagining education in Connecticut. I'm glad to have two very thoughtful and informed speakers with us today. Julia McNamee is a longtime public school teacher and administrator. She's worked in various districts throughout Connecticut. Dr. Robert Golenbach is a longtime Fairfield County resident, and he's just retired after 45 years of pediatric practice in the region. Let me begin by just saying that, as a parent and a teacher, I understand very much the concerns, first of parents, sending your children to schools. Are they going to be safe? Are they going to wear masks? How can they get the kind of social engagement they need as learners? As a teacher, I share the concerns of making sure, teachers have input in the process, the educational process, the decision-making process, to make sure that there are enough resources for not only for your own safety and the safety of your students, but to have the kind of learning tools that are necessary to, adjust to the demands of learning in a kind of COVID and post-COVID environment. And then as a parent, with two parents in the household working, like in our household, I understand the need to go back to work, whether that's physically going back to work or just having the space at home to be able to, focus and concentrate on that work. And so that's a tough thing. These things are not easy to balance. We're gonna, then we also have a very, a shifting landscape. So it's not clear that what may be right when it comes to the balance of all these factors this month would be the same balance next month. But to be informed about all of these issues, I think at this point is the most important thing right before schools are opening, to make the right choice for yourself, for your family, for your children. And as teachers, as educators, my mom is also a paraprofessional in school. So as staff members, as teachers, to make sure that, for our own safety and the safety of the community, we need to be thinking about these things. So I'm so glad to be having that conversation today. I'm just going to start with a brief overview of Governor Lamont's discussion of, the criteria that the state is using to assess risk levels in terms of reopening the educational models in Connecticut. And then just a few of the notes from Dr. Fauci, who was in Connecticut last week to have a press conference with Governor Lamont, specifically about reopening schools in Connecticut. And after that, I'll turn it over, of course, to our speakers, to Dr. Golenbach and Julia McNamee. If you have questions throughout the discussion, please feel free to enter the discussions in the chat and Facebook Live, and we'll try to get to those discussions after we've had a bit of a discussion or conversation, and we'll try to get through them throughout the conversation. So we'll definitely try to answer all of the questions that come in. So just back to the overview, in order to assess the risk level for reopening, the state is using the following criteria. For leading indicators, we're looking at the number of new COVID-19 cases and the percentage of people that test positive. And that's a 7-day average among a population of 100,000. So in order for it to be a low risk, which means it's more likely, it's safer to open up and to open up schools, that number would have to be 10 or less. Connecticut right now is at 2, or last week at least was at 2. And that's compared to other states like California that were in the 20s. New York is actually 3.5, and Rhode Island was at 10. But beyond the leading indicators, there are also secondary indicators, and those include new COVID-19 hospital admissions and percentage of COVID-like symptoms going to the emergency room. So that's all being taken into account. And again, the numbers this month, right, may look different than the numbers next month. So that informs the educational models, the options in Connecticut. The first model, and many of you are probably familiar with this, the first model is in-person learning with masks and social distancing. The other model is the hybrid model, which many schools are using, including Trumbull Public Schools, where students are in schools for 2 days a week in a cohort, and then distance learning for 3 days a week. And then the last model is a fully online model. And again, those numbers and that criteria will help kind of determine what that should look like. And then finally, just some notes from Dr. Fauci for those who may not have seen the press conference from last week, that Connecticut is doing quite well right now to mitigate risks. So our baseline is very good. we're starting at a good baseline. But he did say several times that we need to remain vigilant to make sure we're reducing the risks, particularly as we're starting to bring people together. Some of the most important factors there, of course, are universal using of masks, 6-foot distancing, and since indoors is not as good as outdoors, the key is really ventilation and the circulation of air. And then the last thing, washing hands and good hand hygiene is going to be critical. Okay, so with that overview, I would like to open up this discussion to our speakers who are really going to provide both the medical perspective and the educational perspective, and also an administrative perspective on the reopening of schools and considering and reimagining, education in Connecticut in general. So Julia, let's start with you. From the perspective of a teacher and administrator, how prepared are Connecticut schools, do you think, for the transition back to school in the fall?
Oh, I think that, that's not an easy question to answer. What I would say is that they are as prepared as you can be. Every administrator I know has worked all day, every day, since before schools closed last spring to try to get ready for what we're facing right now. I can't tell you the countless hours every administrator has spent trying to prepare, and of course, shifting frequently to new things that are known to prepare in another way. It's tireless work. And as we learn new aspects of the virus from science, we adjust. As we learn new ideas about what academics might need, we adjust. Teachers are exactly the same. I have teachers who asked late June when we could start using Screencastify to build lessons for this fall. There are teachers in my district who attended voluntarily a week-long webinar on distance learning. I have teachers who voluntarily take part in webinars, take part in planning voluntarily. I mean, everyone cares about the children. So I would say we're all as prepared as we can be today, and probably tomorrow it will look a little different. I think sometimes parents sometimes don't understand why the plans shift or why there aren't more updates, and it's because it's a carousel. It's just always changing and always moving, and we are working so hard to keep up and to make sure everything is as good and safe as we can possibly make it. If you think about it, there's so many pieces of it, right? Of course, there's physical safety in the classroom, there's hygiene, there's instruction, there's buses. I mean, there's so many pieces of this that are all in play. So I think you can have a lot of faith here in Connecticut that people are working very hard and they are as prepared as they can be, is what I would say.
Right, wonderful. Thank you, Julie. And yes, I understand the effort of teachers. I mean, being a teacher myself, I always have appreciated education and teaching, but never as much as I did in this past few months during the pandemic. And particularly for my daughter who's in elementary school, it was her teacher that really kept learning alive for her, for us. It was just amazing, the kind of effort that teachers are really putting in. And they're very much.
I wanted to say, it would be so beneficial to have an educator, someone who's an educator in the legislature, because I wish the legislature was saying to us, what can we do? How can we help? What would make this easier, for all of us, parents, teachers, children? And I do think that is where your experience would be so helpful.
Thank you, Julia. Those questions will be coming up for you too. What is it we should be thinking about as a state? Great, thank you. And Dr. Goldenbach, Robert, from your point of view, what are the key medical risks and points of advice that parents and teachers should be considering?
Oh, thank you for inviting me. I think risk is really a very important aspect of this problem. And, in order to evaluate it, you have to set up your criteria and your paradigm. Before I did practice, I did research. And in research, you control all the aspects of a particular problem so that if everything else remains the same except one part, then you know, basically what you're doing when you change that, whether the result is useful or not. And now, as in practice, um, you don't even know if, assuming that everything you tell people is correct, you don't even know if they're going to follow you, much like the problem we're having with masks. So somebody asked a general about what is acceptable risk to him, and he said, well, in war, we have criteria for acceptable risk. In peacetime, acceptable risk is zero deaths. And that's what everybody wants here. They want basically a very unrealistic guarantee that everything we do is going to be as good as it was before. But when we talk about what is acceptable risk in a post-COVID world, we're more likely to be talking about an analogy with the pre-polio vaccine world, or the chickenpox and measles vaccine world. My parents sent me to school not knowing if I'd ever get polio. And the minute there was a vaccine, which fortunately worked really, really well, I got in line to get it. Then the same with measles and chickenpox, which the vaccines were so successful in a herd immunity kind of way that people don't even realize we used to see people die from these kinds of illnesses. So, so what are the risks? And again, if we can just narrow the discussion, it helps to look at each of these things in a separate way. And the first is children, mostly prepubertal children, up to about age 10. We know several things about them. They don't tend to get this illness. They don't tend to get very sick with this illness. They don't tend to spread it to their families. This is very good news. Yes, children get it from time to time. And yes, sometimes they get very severe illness and even fatal. We can't minimize that at all. But we can, as you say, mitigate it simply by doing the things that have been recommended. And the number one thing is masks. We know we can reduce the spread of the pathogen in an aerosol by about 99%. And we also know that even in older people, if everybody's wearing a mask, even though people who get this illness, 90% of them will be asymptomatic in some studies. And that's very good news, because this disease can have effects that we're not aware of until later. That in some studies in adults, a very large percentage of them who feel fine after finally recovering already have evidence of heart disease. So are the parents worried? They ought to be. Are the teachers and the staff worried? They absolutely ought to be. And that brings up what we can do. And just as you said, the masks, the distancing for younger kids, 3 feet's plenty, believe it or not. 6 feet is a lot of feet in a classroom. And for the little kids, they don't need that much room. But then we talk about the 11 to 20. Not only are these the ones who are most likely to transmit to families, they will get sick the way adults do. And just thinking about it, there may be a whole bunch of them that aren't going to be real careful with masks. I'm very concerned about the reality of teenagers doing what they're told to do when nobody's looking. So this is where it starts to get to be a problem. And the things that you can do in the school and in classrooms in terms of limiting spread and having really good ventilation and distancing. It requires staffing, and it requires somebody who will go to the legislature, like yourself, and impress upon them that you can't do this with the money that the schools have right now, or the lack of money that they have right now. And even before this illness, the teachers were paying for things out of their pocket, but you can't expect them to buy the masks. And that's just to start. The barriers between the desks. So each school faces its own individual problems that include ventilation, equipment, PPE for the adults, staffing, so that we can keep an eye on these kids.
So Robert, let me just follow up on that. How should parents be weighing these risks? Because you're right, it's about managing risks and what risks you're willing to assume. How should parents who are not in the medical field, how do they make these decisions?
American Journal of Diseases in Children says these younger kids who are otherwise healthy really ought to be in school. They need school. Parents need them in school. They can go outside and play, and you don't have to worry about that. They can sit with their masks on, and if they start practicing now, they should do just fine. And even if the masks come off sometimes, they are not the ones we need to worry about very much, because we're talking about Connecticut with those wonderful statistics, if we can just keep that up. So assuming that that doesn't change, the younger kids are easy unless they have medical problems. Now, the kinds of medical problems we're worried about are mostly immune-related problems. There was a lot of talk about asthma that turns out not to be true, as best we can tell now. But children with heart problems and immune-related problems, and possibly actual lung disease, and we're not talking about asthma. They may need to stay home, but otherwise healthy kids, I think they should be fine. And frankly, if the school can reassure parents of teenagers that they've got their eye on the kids, they've got plans for moving them out of rooms as little as possible, and when they do, that they're going to be, doing that in an orderly fashion and keeping their masks on, and then they've got a plan for ventilation. A lot of these schools need to be retrofitted, and that's an expensive proposition, but we've got a little time. If they can do that, I still think being in school, if they're going to get an education, is the best way for us to do it, to take advantage of Connecticut's great numbers, because it's 1 in 100,000 out there who's actually going to be a risk factor for us right now. Right now.
Great. Thank you, Robert. Maybe I'll ask Julia to follow up on that with the teacher's perspective. And as an administrator, Julia, maybe you can share a little bit about both perspectives. How do teachers feel about preparations for the fall? How comfortable are they with the fall plans? What are some of the factors that, as an administrator, you said there's so much going on, it's just like a constant carousel. Can you just say a little bit more about maybe how some of those plans have shaped out and the risks that teachers and administrators are thinking about as we're, so that parents can also be informed about those decisions?
Yes, and what I would say is it's kind of a moving target, as I suggested before. So we have, every school system has, a plethora of committees that are working on different aspects of this. As I mentioned, we have people working on synchronous learning. We have people working on getting Wi-Fi and computers to kids. We have people working on grading policies. I mean, there's so many aspects of this that are being worked on. The first and most important is health, as you might guess, but I think the further we drill down with our plans, the more specific questions we have to ask. For example, what do we do when a student refuses to wear a mask? What are the steps that are taken to try to work with that student? Because as Dr. Roberts said, we want kids there to learn. We don't want them home if they want to be in school. So, how can we work with those students? If we want to minimize, the number of touches on a chair, for example, in high school, how do we do that, right? How do we keep kids from touching other things? I think that's where, there's constantly new information. We were talking about how elementary children are not at great risk, generally speaking. And I saw an article recently that was saying the biggest danger in elementary schools is teachers congregating amongst themselves, because they are, they've missed each other. They love each other. I mean, elementary teachers, there's great camaraderie. So what does that mean? How do we prepare to keep those folks safe? So health is first and foremost for teachers and for our children, our students. But there are it's a spiraling of questions that we are trying to respond to, and we will keep doing that until the kids come back. The second area is emotions. I think that where health is our paramount concern, I think the children's health, mental health and emotions are second. And partly it's because we haven't been in school since March. That's a big deal. We have kids who have been home and maybe lonely. We have kids who have been home and maybe have had a parent who's lost a job. We may have financial insecurities. We have, children who are old enough to understand the threat that COVID presents and who are grappling with mortality at an age we never wanted our children to. And of course, our children who are children of color have had a whole, a whole lot of other things to think about, and hopefully children who are white as well. So emotions, I think, are the second area that we're preparing for, and that teachers are thinking about. How do I build a community in my classroom? How do I help students feel loved? So for example, if you had a Zoom class, the first thing you might do would be to have a check-in with your children, right? You might, even high school kids, how are you doing? Asking them to post stickies or something like that, just to show what's going on in their lives. And of course, the curriculum is another huge area. And in my job, I work in literacy. That's something we've given so much time to. And it's the big shift here is to thinking about what really matters. There are a lot of things that matter in literacy, but if we have less time than we've had and we have kids who are really far behind, how do we pinpoint what matters and how to communicate it to children? There's a quote from Maya Angelou, you do the best you can, and when you know better, you do better. And it feels to me like it's been an endless cycle of that. I'm so glad we don't live in Georgia, where the numbers are so high and where they have started so much before us. We're learning from what is happening there, I think. And so we're lucky in Connecticut. The mistakes that are being made, we will learn from. I think that the bottom line, one of my teachers said, I know how to be a 7th grade teacher. I know how to teach 7th graders. And that is our great gift, treasure, whatever you want to call it in Connecticut. We have really good, dedicated teachers here. And every district I've worked in here, and I've worked in 4, I have admired the educators so much. And I know that I know that they will be working hard. The money piece is important, as Robert said. Ventilation, you can bet your bottom dollar that ventilation needs have been, those are the kinds of things that get left behind when districts are in trouble financially, right? HVAC systems are not where you put your money. You're going to put your money in things that sort of directly work with children, So that's an area where, when we look at inequities in the state, that's another place where a state legislator plays a huge job. Does Trumbull get the money it should have? And we know that it does not, right? There are ways Trumbull schools could be improved. They're wonderful, but that's another role that you would be playing, I think. Sujata.
Thank you, Julia.
Yeah.
And it's important, you talked about the baseline, and I know that Dr. Fauci mentioned that several times, that Connecticut has these options because our baseline is so low, but maintaining the vigilance, and I think one of the lowest in the country.
Right.
And of course, we're still looking county by county. But even then, Fairfield County is maybe 2.5 instead of 2, but still roughly every, Connecticut is about 2 on average. So Dr. Goldmark, how would we, as we're going through the semester, do we have enough data to make good decisions about switching between in-school hybrid plans and online models? And does the presence of a vaccine in the spring change those calculations? And how do how do we sort of assess those risks as we're going forward?
All right. The first thing is assessing on the basis of a vaccine is an issue that we will get to when we have a vaccine. And it has to be one that actually does something, unlike vaccines that are being promulgated by other countries such as Russia and China, which are, basically a 50-50 chance that it might work, that will not do anything for us. As far as how we're going to be able to tell, basically, the way we start is we have to keep track of the wellness of the kids. Taking temperatures is kind of a waste of time, but you can ask them how they're feeling, and you can make sure that if they're sick, that they get seen. And maybe if we have the opportunity, we can do some pooled testing. You may have heard about this. You just take everybody's tests, and if they're all negative, then you're set. And if the pool test is positive, then that cohort needs to be tested individually. And it's a cheap way to keep track of what's going on in a school system that is likely to have, in an a priori sense, a very low level of possible infection. So Connecticut Children's has been doing regular communication with the doctors and mostly the pediatricians in this area, and they've given us lots of useful information. And the fact is, in the Children's Hospital, in the last 3 weeks, there have been no new cases that were admitted. So we're pretty happy with our, as you say, our baseline. And then what we need to do is to make sure we're not wasting our time on things that aren't going to make any difference. Regular masks, you don't need fancy masks. The teachers may need to wear those shields. And if it's not too hot, they're pretty comfortable. So if you wear the shields with the masks, you really are going to protect yourself. And the mask.
Can I ask you just to expand on that? Because I just heard that recently too, that it's the mask and the shield because of the potential for COVID to get in your eyes.
The eyes, yes, but also because this way, the shield alone is not sufficient because it does protect spatter. But if you want to protect yourself and others, so you do a shield and a mask. It's a kind of a two-part protection system for adults. If you're really going to be close to people, the masks alone clearly are going to reduce both symptomatic illness and the possibility of getting the illness in the first place. As I said, just having the masks, those people who do get sick, 90% of them are probably going to be asymptomatic based on the studies that we've seen. But it doesn't mean nobody will get sick. Wearing the shield, because people touch their face, wearing the shield will reduce that for the older people. You're never going to get the kids, the teenagers, to do that, but the teachers can. And as far as reusing masks, that's really not a problem. You don't have to get a new mask every day. Just it has to dry out, you can wear them for a week if you take care of them properly. And some of them can be washed, not the, the paper ones, but you don't need a level three mask. Just looking at some of the notes that they gave me, and you mentioned about what do you do with somebody who won't wear a mask? I don't know. That's why you're the teacher. I think you have a lot of problems that I don't want to deal with. What do you do with the homeless kids? What are you doing with the kids who need school because otherwise they're not going to eat breakfast or lunch?
Yep, exactly. Although our district has provided a lot of food to kids outside of school. So that is one thing, but you haven't even talked about kids who are abused at home, right? That's another issue. Children who...
and the hybrid thing has its positive and negative. The mostly negative is that they're not in school for half the time, and kids aren't used to learning like that. But also, they're spending a lot of time in a mixed system where they are going to be exposed to other kids. They're going to be in their neighborhood. They're going to be seeing adults who may or may not be wearing masks. So that's an issue that you can't control their environment outside of school. So maybe being in school is safer for some of them.
I do have faith that teachers will push kids to wear their masks. I believe teachers will use every piece of leverage that they have with that. So,
Julie, can I follow up on what you said, earlier about the resources? Now that we're talking about face shields and masks that really would provide the full protection, plus making sure the ventilation is proper. What resources do teachers need to feel safe in the classroom? And that's one, not just to feel safe in the classroom, but what resources do they need to have the proper pedagogy in the classroom to make sure that their teaching is actually effective during this time in reaching students?
Those are really good questions. And again, it does come back in some ways to the state. There are things the state can provide that would be helpful. And, sometimes it happens and sometimes it doesn't. In terms of physical safety, I think obviously masks are number one and shields are really right up there. I think the ability to teach students with the distance, I have heard that there are schools that are not doing a great job with that, not here in Trumbull, but that's important. I think cleaning, making sure that you have really good disinfecting and cleaning. And I also think this is something you might not think about, but schools should have really strong plans for routines. So how are we moving students through hallways? How are we having students leave the classroom? All of those kinds of things are very important, I think. In terms of, and even for teachers just to know that if the numbers spike, that their district will close and go to distance learning. So knowing that this is not something where districts feel as if they have to stick with one thing, that the districts can be responsive to the health needs of the community. In terms of educational materials, I think obviously they need computers and they need Wi-Fi. That's a bare minimum. They need access to professional development and to PD on the platforms that are available. There's some wonderful tools online, technology tools, but and truthfully, teachers picked up the reins and rode off last spring. They did so much that was unbelievable. They really need collaboration time. There's a lot of work to be done, and the more they can share it and share good ideas and what failed and what went well. And the last two things I think are the most important. I would say what teachers need, number one, is support. I think they need to be supported by the community and by administrators. I sometimes will read online where parents are so, I would say, vicious about schools and how poorly they perceive that they did in the spring. No one has been trained to do this. Everyone is doing, I guarantee you, the best that they possibly can. So for people to applaud teachers and to support them and to help however they can, I think very important. And the last thing is teachers really need to take care of themselves. It's that whole idea of if you have a child, you put the oxygen mask on yourself before you put it on your child so that you can take care of your child. If teachers run themselves ragged, which I think was happening last spring, they're not helpful to anyone. So administrators, parents, everybody, I think we need to take care of teachers.
I'd like to also jump on your talk about being collaborative. Each school system has a medical liaison, and the Connecticut Children's Medical Center, I am sure, is only too happy to give advice to anybody who would like to have any general or specific questions answered. I am not working at Connecticut Children's Medical Center. I don't get anything out of pushing their agenda, but they've been spending a lot of time trying to find out what the answers are for schools.
Mhm.
And might as well take advantage of them.
Absolutely. And collaborating across fields and across, it's so important now, because we realize that we have to think of education much more holistically. You know, all of these pieces need to come together: safety of the children, well-being. And there's actually a question that came in on social and emotional learning for children. So let me just, ask you, Julia, and then Robert, if there's something you want to follow up on. What should parents be looking for as far as the impact of the social isolation piece on our children? Are you hearing about particular coping mechanisms children have developed as a reaction to this extreme moment? That was a question that came in from someone.
I think talking, just keeping those lines of communication open with children is really important. And, sometimes children are more shy, or they might not want to talk as much. So getting them to draw pictures and talk about them, getting them to write little stories and talk about them. It's really hard. I have heard that parents have set up Zoom playdates with other children as kind of a fun thing to do. Of course, within families, children, I think a lot of children have become closer within the families. I keep hearing stories about that. It's really hard. And I think one of the other concerns is that when we get back to school, it won't be the way kids remembered it, right? Your teacher will be wearing a mask and maybe a shield. You'll be wearing a mask. Everyone around you will be wearing masks. It may be that only half of your friends are in school on any given day, and you will not be able to get close to other children. So I don't think the social isolation completely stops when we go back to school. That's why I said taking care of kids' social and emotional needs at school is going to still be a significant issue.
Yeah, maybe I'll take off my doctor hat for a moment and put in a plug for my other role, which is grandpa. I think family's going to make a big difference in terms of emotion. And one of the reasons are, like, people like me, we don't go anywhere very much. So we may be a safe port in the storm.
Sure.
To offer that socialization, to actually be there, and to be there when the parents are at work, if necessary.
Two other things I would say. I am a literacy person, so my mantra is, if a child wants you to read a book, you never say no. And I do think cuddling with a book for younger children is really, there's nothing like it. But I also know that some schools have set up times for kids to talk with their peers or with a social worker or psychologist to kind of have a lunch bunch conversation about how they're feeling. And I think that's also really helpful for kids. Even if it's Zoom, they can still communicate with each other.
Yes. So grounding in a social community, and I can definitely appreciate now grounding in the family. We've definitely spent so much time together as a family unit, which I really appreciate. But there is that question of, the socialization back with their friends. And you're right, Julia, that school will look very different. And how do they adjust to that? So I just want to encourage people, if you have any questions, there's some coming in, but feel free to just type in questions, and then I'm going to read them like I'm doing now for our speakers, for Robert and Julia. So another question that came in, why the rush to get children back to school when it's not safe yet, since college kids aren't resuming class? Well, some are hybrid. Many colleges have hybrid models, but not all are. Some are online. So should there, and maybe this goes back to the conversation about different age levels. So why the rush to get back to schools? Yeah.
There's that, and there's also community and volume issues. With the children that you're needing to deal with, starting in kindergarten or preschool and going up to high school, there are significant issues in terms of socialization and the ability to follow a curriculum when there's no one there to guide them. College students are, whether they're on campus or not, the teachers are not in loco parentis in many cases. They don't care whether they go to class or not. It's their responsibility to learn it. And in that case, maybe the risks of being on campus and being involved with behaviors that they would come to regret later outweighs the need for being in a socialized situation where somebody's also guiding their educational process. I think, again, the risks here are not so bad, maybe very, very low. And the thing about risk is it doesn't sit in a vacuum. And I have to say, compared to what? The risk of being out in a neighborhood or being at a daycare because the parents still have to work. The risks aren't going away, but in the school system, they're being mitigated to the best that we know how. So, people, you sent me an article for review about pods. And frankly, you're just substituting one set of risks for another. You're asking people who are not trained to teach and also not trained to mitigate the risks to replace a school system. And so, in short,
Dr. Goldman, just to give people context, you're talking about the learning pods where families are actually organizing a kind of private tutoring outside of the school, but following the school, the curriculum in the school. And so if you can say, I was just going to ask the follow-up, we had a follow-up question on that. What do you both think about those learning pods? How should parents kind of evaluate, how should they evaluate those?
Well, again, it really depends on what are your risks, and also what is your ability to mitigate them. If you have a child who's really at risk, health risk, and you think you can control those better at home with a tutor and a small number of, maybe it's just your children, that may be the answer. But frankly, the way I'm looking at it from a educational point of view and also a health point of view, I do think you're kind of substituting one set of risks for another. I'm not sure it's improving anything very much. I'm not an expert on teaching pods, unfortunately.
And Julia, do you have any thoughts on that? Because
I don't exactly understand. People are talking about pods of 4 to 8 children, and I'm not really seeing how that's safer than schools, because if anything, they will be less safe, as Dr. Goldenbach said, because the parents who have, whose children they are, don't know the mitigation techniques. And in fact, I'm guessing kids would not be wearing masks. I'm guessing that they would be touching. I'm guessing there'd be a lot of exposure, and that would be with all the parents in the family as well. So there's that. I think academically, is the person you hire, I don't know, is it effectively a glorified babysitter who's helping your children with the curriculum or helping them stay on task? Or I guess I struggle to see some of the purpose of it. I recognize parents are in a really tough place. And I guess, again, it seems to me it's another way that it's another way that many families are disadvantaged.
Yeah, I mean, I think what's clear now is, probably there are more questions than answers, but I think every family is going to have to weigh these risks, not being medical experts, perhaps not being, educators too. You have to weigh
the other thing, especially if it's your first time as a parent, you feel like every single thing matters so much, right? And so you want your child to get into Harvard or whatever it is, and you feel like if they lose this year educationally, their entire life will be destroyed. But all across America, all across the world, people are struggling with this virus, with education, with living our lives. This is something that I think everyone is trying to do. There's not a perfect way to deal with it, and sheltering your children may not be the right answer in that way. And I've read so many things about the things families are gaining, like slowing down and prioritizing some other things. If your child doesn't get as far as they might have this year because education is compromised, it's true everywhere. It's not just your child. It really will not it will not destroy their lives in the future.
But as you mentioned, we are not going to be judging parents. They get to make this decision, and all the school systems are going to make it possible for them to make this decision if they feel their child is safer in a hybrid system or a totally online system. I believe that's something that most of the school systems are going to be able to give to them. On the other hand, I do think the parents need to understand that in Connecticut and Trumbull in particular, they're in a particularly golden situation.
Yeah, so the baseline, again, it seems, and thanks for confirming that, Robert, that also seems to be an important factor. I have a couple more questions came in, so let me ask these. How should we treat students who are medically at risk?
Robert, you want to go with that one? That seems like
I already mentioned it depends on the nature of their risk, and for some of them, their risk may be high enough that they would have to stay home. And I would say this: each parent needs to have a brief interview with their own practitioner, of a pediatrician, and their doctor can certainly, they have a system, and it's amazing with Connecticut Children's in particular, and also at Yale. They have a number. It's one number we call, and they'll figure out who to send the question to and call us back. And they'll call us back. And the question can be pretty stupid. It's okay. So if the question is, this child has the following problems, what is the latest recommendation? The pediatrician can get that answer from the experts to the extent that they can get an answer. Mm-hmm. So, as I've said, if a child actually has significant heart problems, or particularly autoimmune or immune problems, if they're on cancer chemotherapy, in under many circumstances, they might not have been encouraged to be in school. And in this case, maybe not at all. And that's very reasonable. But as I said, if it's a kid who's uses an inhaler in the winter, or has some other kind of problem that's under control, those kids are probably not at greater risk.
Mm-hmm. The only thing I would add is, I don't think if you have a child who needs to stay home to do distance learning, I think there are a lot of options open to you. So I would just be in as close contact as you can with your school, with your child's teacher, with any support staff at the school, like there may be math and literacy specialists and so on. The first couple of weeks after we start, I'm sure it's going to be hectic, and so for people to get back to you quickly and really comprehensively is maybe going to be difficult. But after we settle into this model, I think that you can get a lot of help. I think people will really want to help children who are home. We want them learning. We want them to get what they can out of the year. And I think the distance learning everywhere will be significantly better than it was last spring. I think people have had a lot of time to think about and to study what's not.
And Julia, does that apply now also for students who may have special needs?
Yeah, well, special needs kids, that's where I think those children really had a difficult time last spring, because the whole the virus and its impact hit so hard. And I think many districts struggled to provide for all students' needs. And I think the parents of children with special needs are especially worried right now. And what I see around me and teachers I know who are special education teachers is an intense effort right now to be ready to help the children, to the best of their ability. It is really important.
Which also requires resources, right? To make sure.
Yes, absolutely. Absolutely.
And then another question that came in, what are the advantages and disadvantages of the hybrid model? So maybe Julia, if you want to.
Okay. So the advantage is it gets kids in school some of the time, right? So they have an opportunity to socialize, which we've talked about. They have an opportunity to build relationships with their teachers and other adults at the school. They have time to practice academic routines that are kind of at the heart of academic learning. And it feels like normal life. There's so much learning that happens when you're at school because you have this cheerleader adult who's helping you, and individualizing instruction. That teacher knows what you need and tries to help you find it. And it means that some of the time you're not there, right? Because we have to do that for all kids to have this opportunity with teachers, right? If we're trying to minimize the number of kids in school at any one time. So those are the advantages. The disadvantage is you're not in school all the time, right? You're in school half the time. And so you don't get that person helping you in the same way. I guess another disadvantage would be that you are at more risk for the coronavirus than if you're at home, distance learning. That would be another downside. So those are what I see. I'm sure Dr. Goldenbach has more ideas.
Oh, it's absolutely true. Just being not at school doesn't mean you're sequestered in a way that's safe. As I said, you may be at daycare. You may be part of a deal with your neighbors that the one mom who's not working that day takes all the kids. Maybe that whether you're supposed to or not, you're playing with the friends down the street. A hybrid model, and I'm not just coming up with this, a hybrid model studies do suggest there may be these risks. And on the other hand, retrofitting a school means you may not have as much room for those kids in a room. So you don't have much choice. So if you're going to do a model, again, you have to talk about what do you do to reduce risk medically and also educationally when the kids are in school, and what do the parents have to do medically and educationally when the kids are not in school. It requires a tremendous amount of responsibility on both sides, and then maybe it'll work, but there's no one size fits all.
Originally the governor wanted everybody back at school full time, and a few districts, including mine, pushed for a hybrid model because they wanted. I think that we wanted to do the best we could to keep kids and teachers safe. So that was where the hybrid idea came from, I think, right? That it was a way to give as many kids as we could time in school with teachers, because we know how important that is for education, while protecting as many people as we could. So that was really the goal with hybrid.
And one more question. Are computer skills a problem for teachers if down the line remote learning is going to be implemented? So if conditions change and then we do shift to entirely online learning, what about the technology skills, that you need for educators to be versed in, in teaching?
Well, it's really key, obviously, right? I mean, we know that even if you are teaching just to the camera, as if it was your class. So you're trying to teach like a bricks and mortar school. There are things you would have to know to make that work. There are so many different educational options that we've learned. And teachers I think, have risen to the challenge. I had a teacher who, absolutely didn't want to do this one really great program that we had found. And little by little, she, got her courage up and she learned it, and she was terrific, and that's where I say we have to help people take risks, and we have to not judge. There will be failure that will eventually be success. And I think that's how we have to treat it. I think teachers, we have to kind of give them permission to take it as they go and to help them when they're ready to make the next step. And it's not that any teacher doesn't want to do what's best for kids. We are all products of our experiences. So yeah, I'm sure there are teachers who will struggle more than others, but there are plenty of people to help. I know in Trumbull Public Schools, one friend I have is Sarah Scrofani, and that's her job. She helps teachers learn how to do things, and most of the people who are in positions like that, they're available till midnight practically. They will do anything to help teachers. So, and as it turns out, there are certain ones that are most effective, and that's something else we have figured out. So what are the ones that we really want to learn how to do and really want our teachers to do? So.
Okay. Great. And so we're coming up to almost the end of the hour.
Yeah.
One more question that came in, and then I have a final question. I just left to wrap everything up. What happens if students don't have access to computers and technology at home? Is this something that the state can assist with? And there are, maybe Julie, you can talk more about what the state is in fact doing.
The state has actually helped a lot, and the Dalio Corporation has also been really generous in donating laptops. So I think I know there is a huge effort to get laptops into kids' hands and to get Wi-Fi hotspots and so on. I know all over the state that's a big initiative, and people call it the digital divide, right? It was and to a degree still is an economic divide, right? We have families who can't afford a computer for every child. Most families can't afford a computer for every child. So what happens if we're doing synchronous learning in digital? What happens then? Who gets to be in class with the teacher? So that's obviously hugely important. I agree. Most school systems are working hard to make it as good as it can be.
And the Trumbull Public Schools just have said specifically they're going to make sure that everybody who needs it through that state program. Great. Well, I think the most important thing, we're coming up to the end of the hour. I think first of all, this is very stressful for everyone, all parents, yes, educators, doctors. We're all sort of balancing so many different factors, risk factors here. And I think what you both said, right, Robert, you said this, that this really has to be a judgment-free zone, because parents are doing the best they can. I'm sure that administrators and teachers are also doing the best they can. We're putting in so much effort, and that doesn't mean we shouldn't have expectations. There should be communication. There should be transparency of what's happening. Input from parents, input from teachers. Like that has to be all part of the process, which is really important. But I think also to appreciate how much effort I think really is going in behind the scenes from everybody in the school system, and that's just so important. So I did want to end on I know that it's very uncertain and a lot of anxiety right now, but on a hopeful note, what do you see as a possibility here for reimagining? That's why the title of this is Reimagine Education. Are there some opportunities here, some possibilities to reimagine education in a better way? And that could, what are your thoughts, just to conclude our—
Absolutely. I mean, the silver linings, there are a lot of them. So as I mentioned before, the priorities, right? What are the skills that our students most need moving forward? That's a great thing, because everybody is hyper focused on certain things. And, I talked about relationships. We're all seeing how important relationships are. There's a lot of new technology everybody's learning. That's great. People are working as a team. People are collaborating and learning from each other. That's enormous. People are taking risks. There's a creativity, because you have to kind of Rube Goldberg a lot, right? You're trying to figure out how to make things work. I'm seeing, because there are so few minutes in the day, because most school days are a little shorter, we have cross-curricular stuff happening, science and literacy and math, and and so there's a lot that's really good that's happening. And I actually think, there's going to be some significant improvements that happen to education as a result of this. I really do. I'm not just saying that.
That's terrific. And Robert, do you have anything that you see any opportunities or potential here for us to, for education going forward?
That's a tough question for me. Not being in the education biz per se. But one of the things is that when you give a child the opportunity to be responsible, sometimes what you get is a responsible kid. And when you have no choice except to grow up, maybe these kids will grow up. They'll wear their masks, they'll wash their hands.
Right.
They'll learn that they have an individual responsibility to the health of their community as a whole. And because they're seeing it in the adults around them, it's different from perhaps some other states. I don't mean to denigrate Florida or in some of these other places. But that's the one good thing that's always found it interesting, that when you force or ask a child to become responsible, sometimes you get really surprised at the responsibility you get. And maybe, as you said, maybe we will have a vaccine and, unicorns will come out of the woods. And
Sujata, I have a question for you. So you work obviously with young adults in teaching at Quinnipiac, and you also have worked a lot with young adults here in Trumbull in the community. What do you see? I mean, do you see what Dr. Golenbach is talking about? That there may be a shift in the young people today?
I definitely, I think I'm an optimistic person. I'm always hopeful that we can do better, that we can get there. And yes, I can tell you, working with the We the People students has been my absolute favorite thing to do in Trumbull, because what they do in terms of, having to think on their feet and adapt to new scenarios, right? That's what gets them the critical thinking skills that we see that we need in college and we need at the college level, and I think you're absolutely right. Like, I do think it's of course, we don't want to be in the situation again. We don't even want to be in it now. But I do think that we should look for the opportunities and the potential that we can take from this to produce better learners. All of us. I mean, I think we're learning. I've learned so much, not only as a teacher, as a parent, with my daughter's teacher in the schools this past semester. And so I do look for those opportunities. And I think we do have so much potential for learning. And this is really the time for us to come together as a community, and I think we can do that together. So thank you so much, to you both, Robert, Julia, for having this conversation. It's so important for parents to be thinking about this, for teachers, for administrators, and for us to go forward as a community. And Robert, you had a final thought.
Oh, no, I just wanted to say it was a pleasure listening to Julia, and I'm looking forward to having you in the legislature.
Oh, thank you so much. Thank you so much.
I just keep the lines of communication open. Talk to your teachers, talk to the principals, talk to Sujata, talk to your doctor. The more conversations that you have and the more you can educate yourselves about options, the better.
Exactly. We have hard work to do, but we can do that, coming together as a community, using all the resources we have. I think that's the way to go. Yes. Thank you both so much. And thank you everyone for joining us. Have a good night.